Good afternoon, everyone, and welcome to the third session of the third town hall of the National Association of Black Counselors. As you know, we have been having these town halls on every Sunday to discuss the implications of Project 2025 and Agenda 47 in the Black community. And today our topic for today is on Project 2025, Pillar 1, that is about policy. This panel discussion will be discussing the policy for the Department of Health and Human Services and how it will affect or may affect uh, individual groups of folks, communities, and things that may be potential consequences in the future. I'd like to take this time to welcome you and welcome our panelists today. I'm going to introduce to you Dr. Cayce. She will be joined, hopefully, but if, maybe not, but we will move on. This is Dr. Nadia Cayce. Dr. Nadia Cayce is the president of Drew and Associates. Dr. Cayce brings a wealth of experience and expertise in healthcare consulting, particularly in mental health and behavioral health equity. Her leadership role as a lead strategist for the Affordable Care Act under President Obama underscores her commitment to advancing healthcare policies that promote equitable access and support for all individuals. Today, this town hall session will be moderated by Dr. Nick Battle. And so at this time, I am going to turn it over to Dr. Battle.
Hi, I'm Dr. Nick. I'm the president of NABC. We want to thank you all for joining us. We want to thank Dr. Cayce for being willing to participate as a panelist. We did have another panelist scheduled. However, life is life, and they were unable to make it. So it's going to be kind of a discussion. As with all of our discussions, you all are free to join in if you have a question, comment, concern, if you have something that you want to add to the conversation. Because this is going to be more kind of like a conversation between Dr. Cayce and I. I don't want to put her on the hot seat with a bunch of questions, and we're just kind of bombarding her because we do appreciate her joining with her expertise. But to get the conversation started, the first question I had was, what key aspects of Project 2025 do you believe the Black community should be most aware of, especially concerning the proposed changes to healthcare programs like Medicare and Medicaid? And how could these changes affect access to care for Black individuals?
Yes, thank you so much. You know what I was going to say is, as a Black woman, I'm always on the hot seat, right? Where many of us are on the hot seat, so we learn how to navigate that in our daily lives. So let's open that up and talk about that a little bit, because the one piece that's going to be critical, right, is that there is an element of healthcare, but there's also other elements that impact, right, our health and well-being, right, such as education. And so if you look at research, right, there are critical success factors regarding optimal health outcomes. Education is one of those. When you think about education, for example, that leads directly to employment, which leads to access to good quality health care, right? So while we're going to narrow in focus on Medicaid and Medicare, the biggest piece is, we need to do our research and make sure that we understand all of the intersections of this proposal as it relates to our health and well-being. So what I want to highlight, there's three major health components, right? And they are related to bringing the manufacturing of prescription drugs back into the United States. There's another one that says we will only pay for any drugs that we have to purchase outside of the US. We will only pay the highest amount that you are charging another country. And the third one is about the elimination of addiction, which is broken down into three categories. One is to address cartels. Two is related to the death penalty. And the third one is about making fentanyl a controlled substance. So if we kind of jump in and take this apart a little bit, one of the pieces that I know all of us are worried about is access. Now, if you watched the latest debate, or the only debate so thus far, former President Trump said he was not going to eliminate the Affordable Care Act. What I would say is that we need to be prepared, right? I would say that it's important that we hear what is being said, but we also prepare for any changes, because we know, right, that leaders can change. So if you think about what we learned under former President Barack Obama, it really was about unity and leveraging our voice. And so I never want to forget about the power that the individuals we serve have. There is power in numbers. And so when we think about voting, when we think about our push around the Affordable Care Act, right, and all of the success that we made, the strides that we made under President Barack Obama, it really is, what we can do is leverage the voice and engage in community organizing. So I want to just kind of highlight that, because that is maybe a little bit non-traditional. However, if you think about what we've done over the last decade, that was critical. I want to also share a little bit about, or harness in on, the elimination of addiction, right? So maybe we're not going back and forth around, bringing drugs back made into the United States. What I would say is that we need to potentially be prepared for drug shortages. And so when we're thinking about partnering with psychiatrists and our other primary care community, we need to know in advance, or help them, right, think about alternatives to current prescription drugs. Some of the components of the drugs that are prescribed for mental health needs are created, majority of them are actually created outside of the United States. So in this switch, there is no guarantee that the prescriptions will be accessible. That's also the same issue when we're talking about capping costs. We are, the idea is that pharmaceutical companies will push back. However, we know that we are a major buyer. And so I'm assuming there may be some level of negotiation. So for those first two, be able to understand the history of prescription use that the folks we serve have, what were, any side effects, and be able to think about and work with our teams about alternatives. In terms of the elimination of addiction, I know we are all on the same page around, understanding the plight of communities of color, especially when we think about opioid use. Cartels, the idea around that, certainly cartels aren't the only components that are bringing in substances, right? Many of the substances, like fentanyl, for example, are used regularly in the United States and are not associated with cartels. So I just want to highlight that, because many of us may, or even the people we serve, our broader communities, may not be aware. And so they're automatically going to associate cartels with illicit substance abuse. The piece around the death penalty is really where I want to hone in on, because I support fentanyl being identified as a controlled substance. Because what that does is it creates additional layers of safety and security regarding access and tracking. The death penalty, though, is where I want to focus in. And I'm not focusing on cartels, right? What I'm focusing in on is that currently the death penalty is not applicable only for selling drugs, right? Not applicable only for selling drugs. And so when we think about those whom are represented, right, you're talking about likelihood of arrest, you're talking about likelihood of prosecution, likelihood of conviction. And then if you're looking at sentencing, it is people of color by far, right? In many regards, across the pre-adjudication, post-adjudication continuum, it is as much as 10 times the amount of time individuals of color serve. And so for me, my concern is related specifically to the death penalty for selling drugs.
Mhm.
Because of course there are other implications like poverty that are tied into that.
Okay, you covered a lot of good stuff there. Uh, the education piece, I loved how you tied in the criminality of it, because as you said, we know, well, this is us. We know that there are some racist undertones. I won't say that,
Sure.
right? When we're looking at the majority of people that get arrested and get convicted for these things. And so now you're making it what used to be, yeah, someone would go to jail for. Now they'll get the death penalty for doing this. But even when we're looking at at opioids and the classification of fentanyl, that's a specific population, right? When
Sure.
things were happening to other populations, these things didn't happen. But now that a different population is having to deal with addiction and all of that, all of a sudden, we want to put in systems to a system. We want to decriminalize this, but we want to decriminalize using it, but we want to penalize the people that sell it that don't come through the routes that we want them to come through.
Yeah, yeah. And to be honest with you, right? Many folks that sell it also use it. So it's about, right, supporting their addiction. So in some ways that's almost contrary, right? Being able to eliminate addiction and then serve the death penalty for it. The other piece that also important is when you think about, for example, in the state of New Jersey, mushrooms, right? In small doses legal. We know we're observing everything that's going on with cannabis. And so I just want you to know, connected to substances is also the fact that in Project 2025, the president will be convening a council to determine if cannabis and other substances promote psychotic breaks. Now, I don't use the term psychotic breaks, but that's the term that he uses, right? And so that is also something that we want to be mindful of, because there is a key connection between substance use and mental health, which we all, I think many of us embrace. However, what is a psychotic break? It's not really defined in a clinical way that is appropriate. And then how is it being used? Is it going to be used against? It's not very clear about what that looks like. The other thing I just want to put a plug in is that one of the other things we could do is really leverage SSDI, which is, right, SSA, Social Security Administration provides financial support for the population, often associated with adults 65 and older, but it's also for those that have identified as a chronic, quote unquote, disability, which includes substance use and mental health. And the third one is for children in foster care. One of the pieces that I just want to tie into around mental health and substance use is that is an underutilized resource. However, when we're talking specifically about substances, it's important to note that SSA is further behind, right, than the field. So in terms of their ability to make determinations, you really have to get a ton of documentation. And it cannot be written in a way that substance use is seen as the pervasive issue. Okay, it has to be secondary to a mental health need and or other issue, cancer, anxiety, etc. So if it is written in a way that that is, quote unquote, the only issue or the pervasive one, then Social Security benefits will be denied. And so that is another way. Leveraging SSA and those financial benefits is a way to offset any negative ramifications that we might experience from Medicaid and Medicare.
But being said, some of these plans also would impact Social Security. So, what do you do when you almost have no recourse, because everything that you would do is affected. I was having a conversation and I was telling one of my clients, because we as a people, we've been taught that to take advantage of these benefits is a negative, right? And ideally, the way that the system is supposed to work, Whoopi Goldberg is a great example. She utilized the system to assist her to get to a place where she no longer needed the system, right? And that's really ultimately what assistance is. What we don't do in this country, we don't do assistance in this country. We take over and we make you dependent on us. But that's not this conversation. And I had a client, and they're in the systems, and they were like, "Well, I'm going to get a job so I can pay these things." And I said, "No, the whole purpose of you being in this system is to get yourself healthy. So if you have something you need to pay, you need to go to your caseworker and you need to tell them this. But if they're putting in place things that are going to take away those programs, it's almost as if, then what do we tell our clients? How do we work with people? What do
So what
we do?
I was going to say right now, it is not clear how SSA will be impacted.
Okay.
So the interesting thing is just to note that while SSA, the reliance on Social Security benefits have quadrupled since pre-COVID to now, they have decreased funding. What was in the last debate was that Ann is in Project 2025. SSA or SSA will not be going away, right? Because we hear a lot about, well, there's not enough money for us. And when we get to age 65, there isn't going to be anything, right? And so at this point,
70. So
yeah, right. And the reality is, to be honest with you, we're not prepared for that because 8,000 Americans, they hit the age of 65. And so that has been going on for the last 4 years and will continue for the next 7 years. So that is the largest number of folks who access Social Security benefits. So what I would say is until we have some clarity, to be honest with you, I'm not sure if we'll ever have clarity in the way that is most meaningful for us. I would consider SSA as an option.
okay. I think that's good. At least that's something that we can walk away and we can let our clients know. So that means that we as clinicians now need to do more research in SSA and how that works, so that we can navigate or assist our clients in navigating through the process and procedures. I will tell you that I know from experience that quite often they get denied.
Yes, yeah,
you have to be
absolutely.
To submit an appeal.
Absolutely. And the writing, see, whomever is rendering the diagnosis and also assuming that person is on medications, right? They're contributors. That documentation is so important. How it is written. Okay. So if you're thinking about what I was saying about substance use being the pervasive issue, if it is written in that way, it's a no-go. The other thing to remember is as there are shortages of mental health clinicians and assessors, SSA does have a group of docs and assessors who can support and do an assessment. Now, respectfully, it may not be as objective, right, as someone whom, like I choose or you choose. However, I would just say that if access for an assessment is delayed for any reason, you can actually request assistance. They don't advertise it very much, but you can request assistance and they are third party docs and APRNs to support completion of the application.
You know that I've had people that have had the docs completed by medical doctors, by their psychiatrists, which is one of the things that I encourage my anyone that comes to me. I'm like, I will be an additional person, but have the primary person be a medical doctor. I just feel like it carries more weight with the people that are evaluating the documentation that has been submitted than if I.
Yeah. Oh, absolutely.
Okay.
Absolutely. What I would say is when we think about parity under the Affordable Care Act, a lot of our agencies were not necessarily educated around mental health and substance use. And I will say that MDs, unfortunately, don't get a whole lot of training in that area. However, that MD just, having that degree or DO, for example, does carry a significant amount of weight. I would not count out our APRNs as well and our NPs, because many folks in the community, see advanced practice nurse or nurse practitioners.
That's good to know. Because like I said, I always counsel them to use a doctor or a nurse practitioner, and I will sign off on supporting what they've already given, or I will give them my stuff, and then they're kind of just rewriting what I've given them, and then I'm providing my input. If and when the reforms outlined in Project 2025 take effect, what proactive steps can the Black community take to protect its interests, particularly in terms of healthcare, education, as you mentioned, and economic well-being?
So here, I really want to encourage people to get involved, right, with organizations like this one. The reality is we have got to leverage our voice. So while there is power in numbers, there are organizations, national organizations that also have access to powerful leaders, right? And to be honest with you, what I would say is how many of us have contacted our congressperson, right? How many of us, because you can do that. You can do that. And to be honest with you, when you do that, it's a lot of significant attention because our leaders are used to hearing from lobbyists and not folks like me and you. And so I say that just to say that when we're talking about protecting our interests, we need to get organized. We need to document. So what is that? When you come to the table with a problem, not that it's incumbent upon us, but also have some ideas of a solution. Because guess what? We've got policymakers who create programs and create policies, but don't understand how that policy is implemented, right? We don't understand the impact of that. And so what is important is that your organization, for example, ABC, becomes the conduit and the repository and the coordinator for that voice. And so I just want to push forward to also say there are multiple organizations at the national level that I would encourage to be able to work together collectively. And so part of maybe what we can do, and I know in some shape it does exist, but what I would say is there a way, or can we initiate some national movement to address these issues? The other piece I would say is we got to get people who are not people of color involved. Issues in communities of color are not only issues of communities of color. And to be honest with you, we expect, right? Leaders expect to see Black and brown faces. You see a white face that is a protector, that is a spokesperson for communities of color, it goes a long way. Oftentimes, we may not engage, right, folks other than Black and brown people in this work. And I would challenge us to think a little more broadly, because if you take a step back, who are the folks in significant positions, right? They're often not us. Who has the wealth? It's often not us. We know wealth is associated with power and privilege. And so, just in summary, we have direct access to the people that we serve. I would say do letter writing. We do a letter campaign. Everybody's not going to handwrite a whole letter, but Dr. Nick, get a track letter, right? A printed letter that's already standard, and folks can sign it, right? Sign it. And then what you do is you coordinate and you identify one day that you're going to jam every fax machine, every phone call, and you are going to flood, right? You're going to flood our leaders. The other piece is that I would say in terms of economics, often we are not educating ourselves about financial literacy. And so here again is, taking a significant challenge and trying to create it into a positive opportunity to figure out, when we're thinking about clinical work, we're thinking about emotional well-being. We know that there are key life domains. Finances is a part of that, right? The reality is that if my finances are jacked up, my mind ain't going to be right. And so when we have to address and support the whole person. So as we think about case managers, counselors, right, and of course stay within the parameters of the entity that you work for, but let's think about supporting and caring about the whole person, including their finances.
You said incorporating folks outside of the community. And I think that the issue that many of us have with involving people outside of the community is when we involve them, they kind of take over. And
Take over.
it stops being about what it was originally for, and the focus becomes on them. And so it makes us a bit apprehensive. And then they're typically the ones that benefit the most from the work that was done. If we look at, as much as they bemoan diversity, equity, and inclusion, and they talk about affirmative action, the people that benefited the most from those policies was not Black people, was not communities of color, right?
Right.
And those people that benefited the most from those, won't say which communities, had a habit of coming in and taking over and making it about them. And then we end up in the crumbs.
Yeah, here's my response to that. You got to set clear expectations. You got to have what you just said. You got to have that conversation because that's real. The other piece is I'm not suggesting either that we go out and just pick people who are white and in positions of power. Think about the cultural broker model, right? So who do you know that is someone that is a true, right, champion? Who do you know that is out in our community? Who do you know that is, in Ferguson? How do you leverage your relationship with that person because you know them intimately, you've seen them in action, and that's where you start. So you have to be extremely strategic. So I'm not suggesting that we randomly kind of reach out to people that we don't know. What I am suggesting is that many of us know someone who is not in the Black or brown community. And I'm going to crack a joke because I'm half, right? So you might get somebody who's like me and form those relationships to be able to move things forward. But you have to have that conversation and be clear about what their role is and what those expectations are.
I like that. I think that I quite often tell people, I'm like, I treat other folks like they treat us. I don't just assume that all of them are good. Like they can be cool with me, but they have a problem with you. I take them on a case-by-case basis. And I think that we have to have a better vetting process of when we invite people to the cookout, right? It can't be because you can sing and you did a few riffs and runs, or you can dance, or you liked something. There has to be more to it than that. And I think that historically it's been very easy.
Well, and I would also say historically we've got colorism within our community, right? And so I know I said that jokingly, being, the only person in my community that had a white mother, right? The reality is that, there's no denial that I'm biracial. I embrace that. I love that. That may be very different from how I identify culturally, right, and ethnically. So one of the things that I also would think about and be real about is who is within our Black and brown community and what unites us, and be aware of our own bias, right? We all have it. So be aware of that as we unite to move this forward.
Well, I mean, the colorism aspect of it, and as they say, all skin folk ain't kinfolk.
Don't get me started on that one.
Being aware of where even we stand, right?
That's right.
And uniting on what our goals, which is kind of what we've talked about in all of these, is coming up with what our agenda is. I see my sister Andrea here, and she was the first one to say, "What is our agenda?" And figuring out what our agenda is, and doing that. I think that we as a community have to have some conversations. I'm going to say this. I don't 100% agree with this, because I don't think that what happens in this house stays in this house is 100. But I do believe that we have to have some conversations about what's going on in our house that are going to stay in our house. And we make some decisions before we share that with the larger community, because we have a lot of conversations on social media and on platforms where everybody can hear the conversations before we've fleshed out what it is that we're trying to do. And I think that in a lot of regards, that hurts us.
Sure.
Because people can take us apart and they can pick up on different things and they can create factions within the community, and we're not then moving together and working towards the same agenda and same goal. So,
well, and be proactive, right? Because I was in a meeting the other night, a small intimate discussion, and a person of color talked about all of the resources that are available, and people, and this not my term, this is the discussion that this person used. People don't want to get better. They want to stay homeless. They want to stay sick, right? And so one of the things that I share is just that we need to be prepared for a counter argument, even if it's not true, right? We need to be prepared. So as we're identifying what our goals are, right, and being very strategic about that, you don't want everything to be so big and lofty. You want to kind of focus in, because you want to know whether you achieved it or not, and you want to, present something that's manageable. Be prepared for the attack. And so you've got to know all of what folks are going to come back at you with well before it even happens, because you're going to be able to integrate some of that in your messaging, and you want to be able to have educated, right, discussions.
that say some of the most interesting things.
Yeah.
Based on what, like, even that comment that people want to be homeless. Nobody wants to be homeless. However, people do get to a place where they don't see how they cannot be homeless.
Yeah. Right.
And that is a difference. Yeah. I have the conversation with school teachers when they talk about the students going to sleep in their classroom. I'm like, that's a good thing, honestly, because where do we sleep? And when you start going down the places that people sleep is where they feel safe and they feel protected. I'm like, so you've created this environment. Now, once they've slept, you can deal with educating them. But if they can't sleep, if there's nowhere that they can sleep, right, then they're going to sleep in class. But you punishing them because you created this space where they do feel that they can do that, right? Like, yeah.
Absolutely.
Project 2025 emphasizes reducing federal spending and reshaping. I'm sorry for laughing at that. And reshaping programs that serve marginalized communities. What risks do you see for Black families and individuals in these proposed changes? And how can local organizations respond to mitigate these impacts?
I do not see support for working with marginalized community in Project 2025. I know that there is language in the videos, like if you go to the website, but that's just kind of buzzwords. So for example, let me give you an example. In Project 2025, one of the suggestions is that we take everyone that is struggling with addiction out of their communities and bring them to a place, right? Now, a place, just go with that. And that we will have all of, case managers, clinicians, docs right there. What I'm going to ask you to do is research Skid Row and how that happened, right? The idea was, oh my goodness, we're going to co-locate everything in a small condensed area, right? So housing services, which conceptually makes sense, right? Look, you go into Walmart, you can get your nails done, grab a sub, get your tires fixed, right? Like, okay, right? We think about that and we're like, oh, that might be a good idea. It isn't a good idea, because if you go back and look at, for example, special education and the educational system, right? That whole idea of sorting and tracking is definitely an issue. So I also would say that there's a lot of stuff that is vague. What does it mean you're going to take everybody and put them in a place? To me, that sounds like a prison, right? Like that. I mean, there's nothing that says it isn't. If I go to a prison, I'm going to tell you right now, prisons say, well, we've got counselors, we got doctors, we've got this, right? But we know it is not rehabilitation. So I do not see support in Project 2025 for marginalized populations. The other thing I just want to let you know is that there is also an element and lots of discussion about race and equity, right? And so for us, it's like, oh, this is so exciting, right? There's going to be an equity, um, an equity body that has repercussions, right? That can leverage um, sanctions against schools, and they're going to be in the school system and looking at equity. What I want to let you know is equity through whose lens, right? So, Dr. Nick, you had talked about policies around DEIA and who is most benefited. Same concept here. Same concept here. Even in the world of special ed, tracking and sorting. Well, wait a minute. You take the kids who are struggling, you put them all here. You take the talented kids, you put them all there, right? The reality is there is so much that is missed, right? Our children that are struggling, there's no presence, there's no standard for rising up. And so the reality is we get trapped. So I just want to say that, one, we got to be careful to what is there, but also careful about what is not there. And those elements around race and equity are not for us. Are not for us. You can, I mean, it's crazy how the data has been manipulated to influence or discourage equity and who is benefiting from equity. So it is being used. If you look at it in context, where they're talking about, the 1776 Commission. 1776, I just want to fall on the ground even when I hear that date. I don't want to hear nothing called 1776, because we know 1776 and every year before, and probably every year after, is not for us, right? It's not helpful to us. So if you start to dig into it, this element of patriotism, the 1776 Commission, the panel that is going to enforce equity in the educational system, when you look at it in context, it is not about marginalized communities as we identify.
Nick, we can't hear you. Could you repeat your question?
Okay, can you hear me now?
Yes.
Awesome. And much of it is about taking money out of systems that make things more equitable, because they really don't, and putting them into places that would make them less equitable. If you're taking money out of the public school system and you're putting it towards charter schools, and you're putting it towards vouchers to go to private schools, those schools can discriminate against who they accept, right?
Yeah, that's segregation. That's segregation, right? Because where are white children, where are white families, right, want to send their white children? And let me just say this, we all want the best education possible.
Yes.
And I'm not going to say that I'm anti-white anything. What I'm saying is, when you look at the structures of how school systems are designed, when you look at access to resources, right? The reality is that it's already segregated, minimized, isolated in funding, right? So form follows function. And guess what? What that means is that is a legalized way to go back to segregating our educational system. I mean, that's an atrocity. That is an atrocity. And to abolish the Department of Education is absolutely absurd. We have special education, right, which is only one way, but there's some controversy around it, but there's access to resources. DOE is the entity by which has manages standardization regarding curriculum, is able to address grievances and concerns when school systems are not following laws. And so the idea then is that, the boards of education are like these little kingdoms, which they already are, to be honest with you. I mean, they already are, right? It's very difficult to leverage and to advocate at that level. But I'm just saying it further removes any protections that we have.
Can't hear you, Nick. Can't hear you.
Winkler pointed out that things are already segregated, and it's not that we're going back. Like it is a continuation of what's going on. And
That's
honestly,
right.
that's what started with the creation of the charter schools, right? Because what happened with many of the charter schools is I couldn't afford to send my child to private school, but I wanted my child to go to private school, but I had to find a way to get public school money for my child to go to the private school. So we'll make the private school now a charter school, right? And we'll use that money and we'll create vouchers, and we'll have a lottery for who can go to this charter school.
Yeah.
Many other charter schools will put in place things like, okay, anyone can join. And Andre, do you want to ask a question? I see you said good afternoon. But
Yeah. No, sorry to cut you. Good afternoon. It's we're dealing with Pillow One, right?
yes, ma'am.
And I was listening to, is it Dr. Nadia?
Yes.
Talk about power in numbers. That power in numbers would have to come at the poll. You know why? Because we're all having the problem and an issue with all these different plans in the project 2025, and starting with pillar one, dismantling of homeland security, education, the FBI. They have already conquered, I would say, Department of Justice by enrolling or employing the Supreme Court, the people in the Supreme Court. So they're already doing things against the people, right?
Sure.
It's pushing the crystal, I call it crystal fascism. So the Republicans are about the crystal fascism, while the Democrats
Oh no, you
are
can put them right in here.
the Democrats are about progress and freedom, right? So powers in numbers would have to come at the voting,
That's
because
right.
the people has to know what they want. If they want, you can't don't have health care, but you want to vote in the Republicans who want to do away with Obamacare, then you go vote for the Republicans. You see what I'm saying? When you don't have health care. But the Dems implemented Obamacare. So you have to know what you're voting for. It's clear. You know what is what, who is for what, who is not for what. So powers in number will have to come with the vote. You have the people, we're defining the different plans they have. So the voters, the people have to get educated on these different plans, because some things are being utilized already. Like I said, the Department of Justice. Yes, that's all I have to say. Powers in number, the vote. Voters have to know what they want.
Well, one of the things that I also wanted to raise attention to is that many people are attracted to Trump's personality, may not at all understand or have read, right, his position. I would suggest that is where, we can take an opportunity to provide some information, right? Because we could say get educated, but our folks, getting educated, do they know where to go? Do they know what information to trust? And so, I would just suggest that folks who are connected with radical views, and when I say radical, I'm not talking necessarily about anything related to school shootings or right, but just this piece of I'm not going to take no for an answer, right? Or I don't want to hear that crap. Some people that I've talked to are like, oh my gosh, I love that he does not take any crap from anybody and that he says what he feels. Those are the times, open up the opportunity to have that conversation. And I would say, and don't do it by isolating the person, because the idea is if we close them off to the discussion, then there isn't really an opportunity to educate. So I would just think about asking open-ended questions: why, how, and also help folks develop some insight between, if they are a supporter of Trump, what is the connection between his position and that person's life?
Piece of it too is that on paper, a lot of this stuff sounds good,
Mhm. Yeah.
right?
Oh, yeah.
Like
Yeah.
when you read it, these are things that you know, ideally you want. You, like you said, create a space where all of the services are in one place and a person can go. And I'm going to tell you, the prisons are already that. Like we got to the mental health hospitals, and that's where prisoners ended up.
Yeah.
I was offered a job working with at Maryland. One was with Prince George's County, working at the Prince George's County jail, and the other was working for the state in Salisbury. And when I asked what, you know, who I would be working with, I'm thinking, okay, so the people that are just getting ready to get out, we're providing them with tools so they don't come back in. Like, nope, you're going to be working with people that have schizophrenia. I'm like, why are these people in prison?
That's
Like,
right.
for me,
Mhm.
my personal morals and ethics, I just could not. I'm like, because this is not the setting for them,
This is
right?
not. This is not.
They're never getting out of here. And I'm basically helping them to be okay with being in prison.
Right. Right.
Right? To
Right.
not cause a
Right.
problem while you're in prison. Because this is
Mhm.
the only space that is left for you other than being homeless.
Mhm.
And under this, homelessness would be illegal.
Mhm. Mhm.
Right?
Absolutely.
There,
Absolutely.
there would be no,
Homelessness would be illegal.
right. Like, so if you are homeless, you end up in jail. Like, so
Yeah, that's a choice. So they will give you a choice. You either go to jail,
yeah.
right, or go to jail. Like, so, or go to a facility, essentially.
And I think that a lot of people, back to the comment that you made, where people want to be homeless, a lot of people that are homeless have mental health issues.
Yeah. Yes. Yeah.
Right. And there is no other recourse for them. There's no place else for them to go.
Right. Right. And the people that are offering them services are also often not trusted, right? They
Yes.
don't trust them. And so that, that's a trick. It's a bait and switch. I don't know about you all, but I definitely have experienced, times in my life where, hey, you can come get this, right? This is what we have to offer. And you go there and they don't have that, right? Or, trying to help a family member get access to Medicaid. I mean, it was absolutely ridiculous. So, yeah, that is the choice, though. And you raised a good point, because we know, there's homelessness is an unfortunate, right, is an unfortunate effect of unmet mental health needs.
And even when you said like the bait and switch, a lot of these services, they're going to turn over to religious organizations.
Yes, that is true as well. Mm-hmm.
And turning it's almost like colonization all over again, right? They came in, they bought their religion, and that's the way. And in order to get the service, you have to now participate in this, right? And so then if
Oh, yeah.
if I
I
want to
mean,
have,
even certified teachers.
yes.
I don't know if so certified teachers must include an assessment of their patriotism, right? And their values and commitment to Christianity and the American way.
Right.
That will be part of the teacher certification. The other piece I wanted to highlight as well is they are looking, the request, or there's another element where the Department of Justice and Department of Ed, before Department of Ed is abolished, needs to come up with a way to address to address those young people that have difficulty in the school setting. So the idea is what former President Trump would call thugs would be expelled immediately. So there's not a process, right? There is not a process of disciplinary action. They will be expelled immediately, and they will go somewhere, right? And the idea of somewhere, when you got the Department of Justice involved, to me, yeah, somewhere is not a place where we want to be.
I mean, and even the fact that if you weren't if you're not enrolled at one of the private or charter schools, that you can be drafted. You have to sign up for the selective service, right? So like they have all of these different things that are in place with this that really will protect a specific population. And it's not even
Absolutely.
all of that. And it's not even all of that specific population.
Mhm,
And I think that that's
mhm.
the piece that people don't understand. It's like, okay, this is designed to keep the people in power,
Absolutely. Absolutely.
right? And that's what these systems are doing. And they're just kind of now they've gotten nervous because they've had to share so much of it. And I was having a conversation with someone, and I said a lot of this is really their fault that they've had to share the power the way that they've had to share it. They're the ones
Mhm.
that have allowed immigrants from all over the world to come in because they make these deals with these countries and they overthrow the government, and then the political leaders of those countries have to flee and they end up here, and they're educated and they've made them all of these promises, and so now they come and they want to be whatever. So they're the ones that are creating all of these different classes, when before it was just two classes basically based off of race. Now you've got all of these different, and how do we remain on the top when we've given all of these other people and the bottom is getting smaller and smaller? You
Mhm.
know,
Mhm.
we're the ones fighting it. But the reality is our populations are dwindling. Our numbers are dwindling. And so they will have to have somebody to replace us. And putting these things in place creates that layer, that buffer layer, right?
Mhm.
Um, but I think that that's like the conversation that nobody kind of wants to have, because everybody feels like I'm going to be the protected class. I'm going to be this is going to make me, if I support this, then I'm in good. And it's like when you start reading through everything, you see how they gradually push you further and further away from the mark. Um, so
I wanted to just tap into what you said. One of the things that's important is that there are always pros and cons to every right decision that is made. So, for example, just to play devil's advocate. Well, some folks want to say, abolishing the Department of Ed will give more power to the local school boards. And, the school board is of the community, right? You may hear that. Or let's look at the school board in DC. I'm just give it an example. Oh, they're born and raised in the District of Columbia. They look like me, right? So there are pros and cons, because you just heard me a few minutes ago talk about how abolishing the Department of Ed, right, could be, in my opinion, is not helpful. So again, if we're going back to how we started, we need to really educate ourselves, because you want to dig in deeper. So, for example, a part of the Trump's Project 2025 is to not provide services to immigrants. So some of us may say, okay, that's good, that's great. Some of us might say, well, hold on, because the person is here in the United States. If they don't have services and supports, they may end up in the emergency room, right? Rather than being able to access a primary care physician who pays for, right? All of those as a society, all of those instances of, utilizing an emergency department, for example, when potentially it's not a life-threatening emergency. Ultimately, all those things impact us, right? Financially and otherwise. So I put it out there just to say that even in situations that you support, educate yourselves as you go out and you become an advocate. Your word is your integrity, which is everything. So be prepared to take on the fight.
also want to create more private hospitals. And Jill pointed out one policy supports allowing healthcare providers to refuse treatment to patients based on their religious or moral beliefs, right?
Mhm, mhm.
I
Yes.
mean, again, so if you come in and I don't agree with your belief system, then I don't treat you.
Mhm,
Like
mhm.
that was an issue that we had as in counseling, where in some parts of the country, counselors
Yes.
did not want to counsel LGBT folks.
Yes.
Because it went against their religious beliefs but at the end of the day, it's not about you.
Mm-hmm.
Right? Like that's one of the things I tell my students in ethics. It's not about you. You have to check yourself because it's not about you. It's about what is best for that client, what is healthiest for that client. I don't care. Like, what does my religious belief have to do with I'm having a heart attack?
Right.
You know, we both praying that. Well, hopefully, we're both praying that I make it. Right.
Yes.
But they could do that. And because we are not educated in this country and don't know the different religions, you could see somebody that is sick and think they're Muslim and be like, oh, they're Muslim, so I'm not treating them. And they're not, they're sick. Like, but we don't learn anybody else's anything.
Right. And so what I hear in that is that's not an external thing. That's an internal thing,
100%
right?
internal.
That's a place where we have the locus of control. As professionals, what I would say is, yes, our employers may have, educational opportunities, but we should not wait for that, right? We want to be excellent at all times. And so part of that is, being on that journey of growth along with the people we serve. We cannot expect the people we serve to make drastic changes if we ourselves, right, cannot jump in and do the work. I've worked with many clinicians, and I've had clinicians, who say, listen, I cannot support someone who is Muslim. I don't believe in it. One of the things is we work with folks who, for example, may have been incarcerated, may have been in the psychiatric hospital. Have all clinicians been in a psychiatric hospital? Right. So I'm just saying that, thinking about the person as a whole is essential to the work that we do, because it could be that pathway of spirituality that helps them to move along in their journey.
Well, I think that we just stop with thinking of the person as a person.
Yeah.
Because so much of this is taking that from, like, so we're making these abstract ideas instead of these are people that will be affected. But as soon as I start taking that away from human beings being human beings and just make it your religion or who you sleep with or your color, then people don't look at it that way. But that is a person that we are impacting. The people are impacted by all of this. It is going to have, and we are all connected and interconnected. It will have rippling effects. Right?
Of course, absolutely.
You're hurting. I may not be there right with you, but I'm hurting too. Because as you said, if I'm using the emergency room for all of my services, you ultimately are paying for it as well. Right? But we don't. But when we do things like Project 2025, Agenda 47, and even when you're looking at Democrats, because we're leaning neither way, both of them, it's very much taking it and depersonalizing it, making you no longer see the person beside you as a person. Now I'm seeing them as their beliefs.
Which ultimately translates into a dollar sign, which ultimately translates into power.
Exactly. Right. And so I don't have a problem with you, Dr. Cayce. I just have a problem with your beliefs. No, but your beliefs are part of who you are. They're part of what makes you who you are. And if I'm saying I'm taking anything away from you, any rights, any privileges, then I'm taking a part of what makes you who you are away. And I think that's what I feel like so many of us don't think about is that because we want to be on top. Right, we want to be that dominant group, but in order for there to be a dominant group, somebody has to be in the bottom. Which I don't want to get into my whole, because I believe that we have to just kind of destroy the system and do something different if we want real change. Like we have to be very radical with this. But just my opinion. My next question. How can Black mental health professionals prepare to support their clients if policies from Project 2025, particularly those affecting public health and social services, begin to limit access to critical mental health and medical services, which we've kind of started talking about?
Yeah. So here's a couple of things. One, we have to see them, just as you said, right, as a whole person. And we have to identify resources that support the whole person, right? So again, if we're just talking about finances, Think about, all of us during COVID, or many of us during COVID, right? We saw some direct connections between finances and, right, depression. So the idea is to, one, yes, continue to do our work in mental health, emotional well-being, and be inclusive. Start to tap into those other areas and familiarize yourself with resources and supports in those other areas, right? The idea is you help with one or two of these factors, and guess what? We track, right? We track outcomes. And so maybe I'm not struggling with depression 5 days out of the week. Maybe I'm reporting, right, 3 days out of the week. So anything we could do to move the needle. The other thing is, I also would suggest that we partner, or I could just ask you all, right, just to think about how well do we partner with our peers and our colleagues, right? So you think about preparing for a session. Are we reading the medical record? Like, are we in there getting prepared? Are we following along? Are we looking at goals and plans? And I say that just to say that I've been there too, right? Where, I'm like, look, I got a productivity. I got to get this person in, got to get them out, right? And I'm overworked and all of these things. And I'm not partnering well with case managers. I'm not taking that extra step. I might have a release of information to be able to talk to, the significant other. Have I done that? Have I done that? We know, right, significant others, families, communities are a key indicator of resilience. And so one thing is, when we're really talking about how we can help, we've come up with lots of ways, leveraging voice, track letters, phone calls, right? I also, though, want to impress upon us as professionals in this industry, just to kind of check ourselves. And are we, we all have great intentions. We are all here to help and to serve. And is there something that we can do a little differently? So I just kind of put that out there, not to minimize our work. I'm one of you, right? We're all in this work together. And I also know how life happens. And so I just put that forth, because while we may face a barrier here, right, in health and wellness, or we may be able to make an impact, health and wellness, through another avenue, such as family and friends. Think about healing some of those relationships, right? I mean, when you go through a hard time, you're calling your peoples. I would love to call my therapist, but guess what? Is that always the case? No, right? And is that sustainable? No. So work on maybe healing some of those relationships. You can do that as a clinician. As a clinician of color, it's very important, because our families are the ones that get fractured, broken up. Kids go, they go into foster care, prison, etc. So think about some of those other ways to impact emotional well-being.
Dr. Cayce, thank you so much for your talks and your talking points today. I got a lot out of what you brought forth today. One of the things I wanted to go back to, because I don't know if you had an opportunity to speak on it as much as you wanted to, and I also have some concerns, but it had to do with the death penalty. And how that impacts the addiction treatment world, et cetera. That's all under the Health and Human Services. So I don't know if you covered all that you wanted to cover, but yeah.
So let's talk about that. So one, we have to recognize that death penalty means different things in different states, right? So for some folks, it could mean life in prison in some states. Death penalty could also mean execution, right? So what I want, when you hear death penalty, the reality is, if life in prison can very much be like death for, or more or less desirable than, right, than death for many of our families and friends. And so going back to, or thinking about Project 2025, it is not clear under what circumstances will the death penalty be applied? So many of us might hear, okay, well, in order to, impose the death penalty, you probably got to be like a kingpin, right? You got to be trafficking major weight. It doesn't say that. Okay, well, maybe you got to be, 3 strikes, right? Or so there's no criteria. There is no criteria that says under what circumstances will the death penalty be on the table. And see that, so again, it's about what's there and what is not there. And so while we all know, right, that addiction is fueled by those that are selling drugs, there's been a push to decriminalize. There's been a push to say, well, this is not a violent offense. Now we're actually swinging the pendulum all the way to the other side where we're talking about the death penalty. The death penalty is not a deterrent. So let's also think about that, right? So it's not a deterrent of crime. And when we look at the progress or lack thereof, depending upon your opinion, but the push around, getting addiction in the DSM-5, the steps we've made with at least SSA kind of recognizing addiction. Now I don't know, right? So again, that's almost contradictory, if that makes sense. So when you look at the research, this is applicable probably to many of our family, friends, and loved ones, right? As it is currently written, which is very vague and general. And so that to me is very, very scary in a system that we know is already biased, right? That is broken.
Right.
When we think about public defenders, right, we know if you look at the data, private attorneys tend to, right, get more favorable outcomes than public defenders. It's not about their level of expertise. It's about being burdened, right, with the number of people that they are working with accesses to resources to do forensics, et cetera, et cetera. So that for me is one of those primary factors. If I look at all of this, the death penalty for selling drugs, DOE and DOJ, a child being able to be expelled for an incident, and I say that singularly, and it didn't say anything like having a weapon or anything like that, an incident in a classroom, being expelled and being placed somewhere, and bringing people who struggle with addiction in isolation together. Those are the 3 for me personally, while I don't agree with anything here. Those are the 3 things that rise to the top for me. They impact me personally.
Thank you for that. I wanted us to try to get to some of our audience, and I'm going to ask Dr. Winkler to speak on the comment that he's put in the chat. Addiction is fueled by living in an oppressive society, which makes that obtainable therapy. Dr. Winkler?
Greetings. I don't know if I have much more to say than that. Sometimes I think in these conversations, including what we have here today, when we talk about Project 2025 and things of that nature, sometimes it has us looking at one issue or this party versus that party, and not a oppressive society. In fact, it will also begin to blame, not intentionally or unintentionally, those who are oppressed in the system, who also are trying to struggle through that system to make a living. So what happens is, what I mean is, if you set the proper conditions and you put certain types of, or allow certain types of self-medication to be easily obtained, that is what people are going to do.
Absolutely. And what I would say is, let's think about what oppression is, because we oppress ourselves, right? It's institutionalized at a systemic level, right? It's at a systemic level that is then integrated, permeated through our communities, our daily lives, ultimately, by which the oppressor doesn't have to oppress because we oppress ourselves through colorism, et cetera, et cetera. So, Dr. Winkler, I'm right there with you.
Yeah, but I also would say that I think at some point that's not like some of these things are not conscious self oppression. In fact,
Yes, of course.
so even colorism to me, you just call it racism.
Mhm.
I mean, because it came from somewhere, and it is
Absolutely.
people trying to be like some people. Is people trying to emulate that the oppressor themselves so they can be somebody. Is the people trying to find out how to live in a society in a way that means they are worthy, that means that that their children can be successful. We are in a society that perpetuates, no matter what party you belong to, oppression. I had some thoughts and ideas earlier, but it kind of escaped me. But what I'm saying is, I think sometimes when we just focus on one end of the spectrum, even some of this issue around Project 2025 and why some of our people were even aim in that direction, because we're not really speaking to the. I'm not talking about you, Dr. Nadia. I'm talking about on a level that we're not really speaking to some of those policies really touch our people, as Dr. Nick spoke about last week. That some of our people are very quote unquote what you would call conservative, whether or not you say differently. There's still some things in there that really look like what we believe
Yes.
is us. So I think in some of the things that we talk about on the other side don't look like us, but we don't talk about that.
Right, right.
I don't think Black people is as liberal as the white liberal that we're imitating. And I think that's part of the problem. So I think that we have to look as Black people, we need to really talk about this thing in a more nuanced way as we will get to that.
Well,
Thank you.
Sister Andrea just put it in the chat. I'm not gonna say what she said because people already think I have a problem with a specific religious group. And she put that group in her chat. I will let Angel read what she wrote. So I'm out of the hot seat.
Thanks, Dr. Nick. Let's see. She says Project 2025, 4 pillars, appears to support or take us back to Jim Crow era. The problem is that many of our people were taught Christianity. But what I see is that many of our people, like Trump's policy on eliminating gender care, they see LGBTQ as wrong, sinful in the eyes of their religions. But they are not looking at the great impact that is awaiting them if all these plans are implemented. Hence, our people cannot look at Project 2025 or Agenda 47 in just some parts, but examine the whole parts of the project and see how it will impact them. Like I said, Project 2025 pushes Christo-fascism and not, and not saying the Democrats are better, but their policy supports progress and freedom. They still have work to do in all inclusive. Thank you, Andrea. There's a comment here from Jerry Whitted. What strategies can be implemented to stop the revolving door treatment of mentally ill chemical abusers? And how can mental health counselors play a pivotal role in ensuring sustainable recovery for this population? And I think I want him to be specific as to, is this current? Is that a question for what's happening currently, or what would happen if come November these policies and the conservativeness of the 2025 and Project 47 are implemented? Is this before or possibly after?
After.
After, okay. Dr. Cayce?
Yes. So that is a very lofty, right, question that I'm not sure we will be able to address, right, without all of the stars aligned. And when I say all of the stars aligned, you know, one of the most difficult elements is our perception of substance use and mental health, right? So that perceptual change that is required that drives policy, resources, programming. If we're talking about, what is within our control, we really touched on a lot of that already. Engaging families and communities is really important. And matter of fact, when you dig into the work that we do, it is often non-traditional strategies that have the greatest therapeutic impact, right? Think about all these evidence-based practices. I'm certified in 8 of them, right? So you look at that, EBPs are considered the gold standard. They're often normed on middle-aged white people, right? So I say that just to say that it is incumbent upon us to understand and know strategically what really drives, right? What really drives emotional well-being. Yes, clinical counseling, treatment, meds, all of that. And right, let's think about our normal lives, right? And so families and friends are critically important. So if we're talking about the revolving door, let's be open to thinking about spirituality. Let's start to work on bringing families together and having some discussion, some psychoed. Hey, let's talk about schizophrenia here. Let's talk about, right, the experience of someone who is living with addiction. We've got to, I would say, broaden our perspectives of what clinical treatment is. Matter of fact, if you look at other countries that are extremely impoverished, and we say, oh gosh, they, believe it or not, in some instances, their clinical outcomes are greater than their own. And we've got all these degrees and letters and numbers and all of these elements. So I just say that part of what I suggest is to go back to basics, right? And I say our roots. What is it that got us, 400 years ago, right? What is it that got us through, right? It's family, it's friends. I would also say thinking about developing relationships. So we are taught about ethical boundaries. And I am not saying that any of us should be unethical. What I am saying is that much of what we have learned is based on traditional westernized medicine, right? An illness-based field and an illness-based approach. And yes, recently we are learning more. We're learning more about culture. We're learning more about, non-traditional healing, but it's not enough. It's not enough. So I say that just to say that everything we've learned, right? You can think about, even in our past or things that, we're taught in school, doesn't mean that it's right. And so I just encourage us to think about how building authentic relationships, right? And not just throwing around buzzwords like, person first, but really being able to find a way that you connect with that person, and within your comfort, be able to share, because understanding that that person is a human being first is essential, and we must treat them, in that way. And so I don't want to keep going, but I also want us to be very mindful of the language that we use, because language is extremely powerful, and language reflects, right, our thoughts, beliefs, and perceptions. We tend to use language like client, right, that is based on how a system is designed, but yet we're sitting here saying the system don't work and the system is broken and the system is. So I also encourage you to think about the language that we use, right? We want to call Miss Moss Miss Moss. That is essentially important to building relationships and being aware of our own biases and barriers that get in the way.
Andrea had a question. Her hand's raised.
Yes. About the substance use, I'd like to put my 2 cents on it.
Come on, Andrea, roll with me.
Yes, substance use, right? Most people use substances to escape their reality.
Mm.
Of course, when you look at the pillars about death penalty for drug dealers, most of our people like I said, they escape their reality with poverty. They can't stand the pressure of oppression. You name it, different things why people use substances, so they want to escape their reality. Now, I think our people need to look further than our nose. Because if you examine the plan, it's a setup for us non-white people, for people, even white people, poorer class of people. But our people mostly, our people use substances. Everybody use substances. It has no discriminatory. It does not. Drugs does not discriminate, right?
Mhm.
But then most of our people are trapped in the penal system, and if they don't look further than their nose and examine the whole parts of the project of these projects, I'm sorry for them, because they're the ones who are going to be more receiving the death penalty. They're the ones who are going to, be trapped. How the Republicans want, for me, how they want us people, they want us, for me, they want us to be eliminated or something, because setting a policy like this, it's not all inclusive. It's not all inclusive.
Right.
And so we are, like I said, the powers comes in the voting. You can't just look at, oh, because my religion hate LGBTQ people, because it's a sinful act or sinful. They came with the religion. They taught us that with and now they're implementing something to go against all that. That's like confusing us, like confusing people. It's a confusion. Yes. So I encourage our people to look at the whole plan, not just us sitting here, but everybody. Because I see Black Trump pie, I mean, I respect everybody's worldview. Everybody is free to do what they want to do, but this plan is a setup to take us back to Jim Crow. Yeah, like seriously. Yes, that's my 2 cents.
Okay,
Thank
thank
you.
you. We're getting close to time. I want to ask if Cliff, I get so much out of what you share. Would you like to add any comments to this before we close out?
Yeah, I'm not so sure. I mean, I do not consider myself to be an expert in a lot of the clinical psychology, clinical counseling perspectives that the rest of you come from. I think the main thing that occurs to me is, well, number one, there's two things, I guess. Number one, all of these things that have been discussed, taking people with mental illnesses and putting them in a place or putting them in an institution or doing this, that, or the other, whether it's jail or a hospital or whatever, it's still going back to a centralized way and a not community-based way of dealing with people who are suffering from whether it's substance abuse or various psychological or psychiatric conditions. So it, to me, looks like another mechanism of increasing control over those people, over those populations. It was mentioned earlier about the possible effects of abolishing the Department of Education and quote unquote sending the decisions back to local jurisdictions. Well, the same person who is apparently backing this idea of sending control back to local jurisdictions wants to take over Washington, D.C. Okay, so that's a direct contradiction to this localizing control, localized or states' rights perspective. And you abolish the Department of Education. First of all, every time I'll say these particular folks have decided that they wanted to abolish a thing, like W. Bush wanted to, well, he basically subordinated FEMA. He didn't abolish FEMA leading up to Hurricane Katrina, but he subordinated it to what? He subordinated it to the Department of Homeland Security. So it was no longer so much about responding to disasters as it was about putting more government control over what people do, where they move, what they say. So to me, they give all this talk, and this kind of goes to my next point. They talk about increasing our freedom. They talk about sending rights back to localized communities. But what they do is entirely different. They talk about peace and they gin up war. They say that they're going to send power back to the localities. But when you abolish the Department of Education, okay, then where are you going to take that authority? Where are you going to put it?
Mm-hmm.
I think they're going to take that Department of whatever decisions Department of Education made, they would then give those decisions to someone else.
Mm-hmm.
They appoint. Trump has already said he wants to get rid of and reshape federal government, wants to get rid of professional civil service, wants to put his own acolytes in positions of authority and management. So again, this is taking the decision making away from people who've spent their entire lives learning how to treat people, how to manage these kinds of systems, and put them in the hands of essentially political hacks. And if people question that, all they got to do is take a look at what happened the last time Trump was president. What did he do? He put the Department of Education under Betsy DeVos, a political hack. He put the Department of Housing and Community Development under Ben Carson, a political hack. He put political hacks in charge of everything he possibly could. It no longer was about whether or not you know what you're doing. It was all about whether or not you were loyal to him, whether or not you followed the dear leader. That's what it was all about. So to a degree, I think it is important to look at and dissect what Project 2025 is saying, what Agenda 47 is saying, at least to get an idea of what they're telling the people, and not what they're telling the people is just completely you know what crazy. But on the other hand, I also want to compare what they say with what they have done and what they're already documented as having done. If you want to go back to the days where Muslims were barred from entering the United States, if you want to go back to the days where the Paris Accords on climate change are abrogated and are essentially thrown out the window so you can drill, baby, drill. If you want to go back to the times where your head of state is kissing up to Duterte, to Erdogan, to Orban, to Bolsonaro, to Ben Salman, and to Putin. All six of them, by the way, are documented as dictators who have essentially waged war against their own people and waged war against neighboring countries. You want to go back to there, then I guess your choice is pretty clear. So to a degree, I think the discussion that we're having is important just in terms of what they are saying and what they're putting out there in the public record. But at the same time, we got to recognize that this guy speaks with a more forked tongue than most of the other presidential candidates that we've had to deal with. And that's not to say the Democrats don't do it too, but this guy has got a forked tongue that drips with as much poison as he can possibly find. They're eating the cats, they're eating the dogs. I mean, come on. They're going to abort the fetus after it is born. Give me a break. It sounds that if anybody is in serious need of psychiatric and psychological care, it's him.
Thank you, Cliff, so much. Thank you.
Cliff.
You might not be a clinical expert, but I think your prognosis, diagnosis, and treatment plan is accurate.
Absolutely. Well, I just want to thank you all for coming again, Dr. Cayce. You're welcome to come back next
I'm
week.
excited. Thank you.
Yes. Please. Yes.
And Jill, before you end, so what I was thinking, Dr. Cayce, is just to kind of wrap this up, because everything in Project 2025 is intentionally vague. So when we're talking about if this does come into place, what we can do, because these things are written so vague, is it possible that, to your point, we could come up with our own healthcare systems and our own things that we implement, because it doesn't say that we can't, to protect our people?
Yeah, so one of the things I would say is it takes some pre-work, right? Because we don't want to sit around and wait.
Okay.
So one of the you know what I mean? So one of the things to think about is, given this context, right? Instead of saying a place, is it a therapeutic, right? So we're able to articulate, if in fact this is brought to bear, what are the ways that we can mitigate the negative effects? And so you're right, Dr. Nick, right? This is an opportunity where we're not only thinking about, we're going back to what Andrea said, the vote, et cetera, et cetera. We got to do a concurrent process. And so given these pillars, what can we do? Where do we see our role and our ability to influence? And so you're right there. Those areas of vagueness are vague for a reason. And this is our chance to be able to step forward and influence. Absolutely.
So we could define what those places are. So we,
Yeah.
like Angela and I could decide, okay, well, we're going to open up our own place and we're going to make that the option of the place that people could go. And we know what our people need, so we're going to design it around our people's needs.
Yeah. And in the absence of that, you know what is available, right?
Exactly. So just so that our people can go away like with an idea of, oh, Cliff raised his hand.
No, I was just going to add one last little thing in terms of I guess this is sort of like in the what do we do now kind of a thing.
Mhm.
If we look at it and say the government is, whether it's a Democratic Party government that sometimes just looks the other way and takes us for granted, or a Republican Party government that likes to abuse us on a regular basis, then what we need to do is we need to get to developing our own systems, just develop completely independent systems. This symbol that I have in my background is the symbol that more or less kind of describes the whole cooperative coalition approach that we're trying to formulate in Maryland. And one, I call it spokes of the wheel because it looks like a spoked wheel. And one of the spokes there it's down toward the bottom, but it's basically denoted as a science, technology, and health spoke. I mean, economics is international, this international activism, there's prison activism, there's revolutionary Pan-Africanism, there's culture, there's spirituality, grassroots, education, legal, media, and political organizing along with that. And there are others too. But the idea would be that then we need to find those areas where we are not particularly strong. And I would say that the area of science, technology, and healthcare is one where Pan-African organizations have not effectively reached out to our professionals, people like you who understand a lot of this stuff, and bring those professionals, bring those experts in to the whole Pan-African organizing discussion. We got tons of folks who want to make some money, so they're down with the whole economic thing. We got a number of people like to pump their fist in the air and say we are at war, even though they've never been in so much as a bar fight. We've got people who can sing and do some poetry, and so they're cultural. We got some folks who say ashe and go to the Nsamamfo and the Orisha, and so they're spiritual folk. And we got some people who have newspapers and blogs and websites, and we got a couple lawyers, but not enough. But among the areas that I think that our Pan-African organizing effort is weak is in the very area that you all represent right here, and that is from not just the physical health, but also the mental health aspects of what's happening to our people. And that's behind suicide, that's behind drug abuse, that's behind all kinds of stuff. So I would say that among the things that we need to do a better job of as organizers is bring in professionals such as yourselves into this entire effort so that we can start to build a really holistic plan, a holistic strategy to move our people forward. And I figure the sooner we start, then the sooner we'll actually have a solution, and there'll be fewer Zoom calls where we wring our hands and say, where's our plan?
Yeah. A document. So any approach, ideas that you have, document them, clearly articulate them, And also, if you're implementing, right, if you're getting to that place where like I'm launching something, please collect data. Please collect data because data is powerful. Okay. Data is powerful. So collect data about what you're doing, how many people, what are the outcomes, right? That is essential because that is what makes people listen, right? Money talks.
Yeah, yep.
And about one last thing, on October 12th, and I've talked with Dr. Winkler about this a time or two, and so I don't think I'm cold cocking by any stretch of the imagination. But on October 12th, we're planning to have a Pan-African town hall meeting here in Baltimore, and assuming there've not been any roadblocks or anything, our plan is to have it at Dr. Winkler's establishment, Temple of New African Thought. And the purpose of the town hall will be to talk about the electoral process and how we approach it as a community. It's the idea, the intention is not to turn it into a candidates forum. I don't want to have a parade of people getting up in front of everybody saying, vote for me and I'll set you free. Rap on, brother, rap on. No, instead, what I want it to be is a discussion of how we process the electoral politics, the assumptions that we take. If you don't vote, you don't have a right to complain. If you do vote, you're a sucker. If you vote for the Democrats, you're voting for the same old failed policies. If you vote for the Republicans, you're voting for the enemy, lesser of two evils. All those kinds of things. So what we want to do is we want to take a look at a lot of those assumptions, and if there's a way that we can, in very brief bullet format, put the essential platforms of the Democratic Party, the Republican Party, the Green Party, the Libertarian Party, in Maryland, the Ujima People's Progress Party, which is a black worker-led political party, and put those things up there so people can just see them in bullet form, not have somebody get up there and speechify and bloviate about their party versus the others. Just put them up there and then just have a discussion with each other about how we come to the decisions we come to, so that when we do go to the polls or don't go to the polls, we're doing it based on information and not based on wild assumptions that we too often make. So that'll be coming up on October 12th. And by saying that, I want to, of course, invite everybody here to come in. And if you got some things that you want to present, then I guess around now would be the time to say, yeah, I got something I think would be helpful to the whole conversation. And then we can arrange to set it up so that either in person or through Zoom, people can make those presentations for the community.
All right, thank you so much for that. I think you mentioned that once before. Maybe we can get some more detailed information on that from Dr. Winkler that we can share with the association maybe on our website. But again, I want to thank you, Dr. Cayce, for coming, doing a fantastic job, and all of our attendees who, I'm sorry we couldn't get to everyone who may have had a question, but we welcome you to come back next Sunday, where we're going to be talking on Pillar 2, which is personnel. And this is very key to some of the things that we talked about today, because there are proposed policies for what would happen to federal employees, the Department of Justice, which we kind of touched on today a little bit, and also Homeland Security. So in the chat, I have put the link to the 900-page mandate for leadership, which we call the objectives to implementing Agenda 47. So the table of contents is there. It's an easy read. If you get an opportunity to read up on those policies, federal employees, Department of Justice, and Homeland Security, prepare some questions that you may have in addition to what our moderator will have. It will, give for a full discussion next week. Same Zoom link, same time, 4 o'clock. And we will see you then. Have a great and safe rest of the week.
Thank you.
Thank you. Okay, Mark.